Welcome to the June 2026 Nonviolent Medicaid Army Saturday School.
Hello everyone, my name is Erica. I'm here in Richmond, Indiana, pronoun she, her, and I'm going to share with you guys our goals. Goal number 1, understand how organizing for Medicaid specifically allows us to unite the leading social force. 2, unpack the political economy of healthcare and how organizing Medicaid for all meets this movement. 3, we highlight the power of sharing Medicaid narratives in challenging mental fortresses around Medicaid and uniting the poor for fundamental change to create healthcare from below. And I will share with you our agenda. We have our Mística, we have our goals, agenda, and community agreements. Who is the NVMA, Nonviolent Medicaid Army? Our theory of change and organizing for Medicaid for all. We have political economy of Medicaid and single payer. We have challenging narratives of Medicaid. And also on our agenda, we have small groups and closing.
How are y'all doing? I'm Aaron from Tulsa, Oklahoma. The Nonviolent Medicaid Army of the Poor is a growing politically independent force of the poor and dispossessed, united across identities, regions, races, and issues, modeled after MLK's Nonviolent Army of the Poor from the Poor People's Campaign of 1968. Those who are on or excluded from Medicaid represent the diversity of the entire working class and are impacted by every single front of struggle. Excuse me. Housing, living wages, food, education, debt, migration, incarceration. The fight for Medicaid is common to the North and the South. Being on or excluded from Medicaid objectively unites a huge section of the leading social force, the group of people that has the most to gain and the least to lose from a fundamental transformation of society.
Awesome. Thank you so much, Aaron, for grounding us in who we are as the Nonviolent Medicaid Army. Thank you, Michelle, for opening us up, Kelly for taking us through that Mystica and really grounding us in the stories of Medicaid, stories of our healthcare experiences. That is really why so many of us are here today. And big shout out to Nick and Evan, who are supporting us with tech, a really difficult job, tireless job, and appreciate you all contributing your time and your expertise to that. So today we are here for our June Saturday School talking about why do we demand Medicaid for all, specifically Medicaid for all, and how is that different from other things you might have heard, other calls you might have heard for things like single payer or Medicare for all, or these other ways that people talk about healthcare. So we want to spend the next hour or so really diving into it, really getting clear on why Medicaid for all is what we are demanding and how that really fits with the way that we think about what we need for the sort of change that we're fighting for. And so get us started on that. I want us to start with a refresher on this diagram that some of you all might have seen before, which is a diagram of our theory of change, which means the way that we think about change happening and what is required to create the change that we need. And we want to start with this because our demand for Medicaid for all comes directly from how we see change happening in the world and the change that we need. And so this theory of change, which was developed through study and through struggle and through coming together as we formed our organizations and formed our movements, this theory of change identifies that the only way to face the fundamental problem of our time, the crisis that we're facing in systemic racism and militarism and poverty and environmental destruction, the only way to face that problem is with a united social movement of the poor and dispossessed, what we call a leading social force. Right? That is the only way to change, to face face these evils of our time, face the fundamental problem of our time, is with that united social movement. So our task before us then is to build that movement. To do that, as we see in our theory of change, we need to be able to develop leaders of the poor who are forged through struggle, forged through strategic struggle, who can lead that new army, that new and unsettling force, that united social movement to face the evils of our time. So to build that movement, we need to find and develop leaders. And so then where do we find these leaders? And in what ways can they be developed? Right? I think that is one of these core questions that are faced with this. If we know that we are facing these evils of our time, the only way to fight these evils is with a united social force, a united movement of the poor and dispossessed. And if the only way to get that movement is to find and develop leaders, then the immediate task before us is, how do we find and develop leaders? Right? How does that happen? And so the fact is, a huge portion of the people that we are connecting to and trying to organize, of the poor and dispossessed, from which we hope to identify and meet leaders, is on or excluded from Medicaid. Right? The experience of being on Medicaid, or of getting cut off Medicaid, of getting kicked off Medicaid, of dealing with the care that comes with Medicaid and the frustration of our system, those experiences are a big part of the experience of our base, of our leaders and our future leaders. You can go to the next slide, which gives us some numbers that illustrate this. Right, so as of January of this year, this comes from data from a group called the Kaiser Family Foundation, which does a lot of research around health and health insurance. Over 75 million people were enrolled in Medicaid, or CHIP, the children's kind of version of Medicaid, across 50 states and the District of Columbia. Over 75 million people, right, were enrolled in Medicaid and CHIP. That is a huge portion of everyone in this country, and a huge portion of the people that we are connecting to, and who make up this movement that we are building. Can go to the next slide. And we know that people who are on or excluded from Medicaid represent all different segments of the poor and dispossessed, of the working class, as Aaron mentioned kind of in our opening grounding as well, right? We have children, we have adults, we have elderly adults, so we have people across of every race, of every religion, of every political. People across all these groups have the experience of being on or excluded from Medicaid. And so organizing around Medicaid, around that experience, that material experience, that day-to-day struggle of being on or kicked off of Medicaid, that connects us to these millions and millions of people. And that allows us to unite people in a way that other conversations and other slogans and calls around healthcare just do not, because Medicaid touches people in a way, and people are impacted by Medicaid in a way that we don't see with these other ways that people are talking about healthcare. And we know this not just from these facts and figures, and not just from our kind of study and learning, but in our own practice, right? We have seen this through the organizing of the Medicaid cutoff organizing drive. You can go to the next slide. We know that this organizing drive began with the Medicaid cuts under Biden, have continued and deepened. Oh, sorry, can go to the next slide after this. Right. So we know that these cutoffs have only deepened in the last few years. And it is through organizing specifically at the point of survival around access to Medicaid and being cut off Medicaid that we've been able to connect to our base and develop and build and find the leaders that we are looking for, right? We can talk about attacks on healthcare as a whole, and a need for care in general, which we do, but the specific experience of being on Medicaid which we get at with a really high level of detail through appeals and applications and education around cutoffs. That specific experience, that specific tangible experience, is the experience that our base has. And so if our goal is to find and build leaders, then organizing around Medicaid allows us to connect with the broadest segment of our base and organize the group with the most to gain and the least to lose from a fundamental transformation of society. You can go to the next couple slides. Go through. And this just sort of illustrates this organizing, right? This is organizing we've done on the ground through the Medicaid Cutoff Organizing Drive, where we are meeting people and speaking specifically with people around this experience of Medicaid, of being on Medicaid or being cut off Medicaid. And this is how we are finding and building leaders, through this specific organizing work around Medicaid itself. And this is only going to get more and more true as time goes on, right? So as the so-called middle class collapses, as it gets harder and harder for people who were previously financially comfortable and relied on private insurance or employee insurance, as that gets harder and harder for people, more people are going to have to turn to Medicaid, not less. And so that base that identifies with Medicaid, with this experience, is only going to get bigger and bigger, right? The base of people that we can connect to through organizing around Medicaid specifically is only going to increase, it's only going to build. And so this is the first core reason why we demand Medicaid for all specifically. It is a strategic choice stemming from our theory of change that allows us to connect to the largest portion of our base to build a movement, right? It is a movement building strategy. We believe that change comes from below, and so that any change to our healthcare system must also come from below. And the way to do that, to build that movement, is to organize around Medicaid as a specific part of the experience of the poor and dispossessed. So as part of our movement building strategy, as a key part of our movement building strategy, we are organizing around Medicaid for all specifically and strategically. Okay. I'm gonna move us forward by passing it on to Bruce from Wisconsin, from the past. Bruce really wanted to be here with us today, but couldn't make it in person. I've spent a long time thinking about some of this stuff. And so we recorded a piece of content that we'll play.
Thanks, Mark. Shout out to my movement family in Wisconsin, especially the watch party at the Two Library in Oshkosh. So our movement building strategy is also shaped by our understanding of how the system works. Why does the current healthcare system exist if it doesn't meet people's needs? Is winning a single payer form of healthcare by itself enough? In this first slide, we state in the Nonviolent Medicaid Army that we offer an answer how to unite the poor through the struggle for the right to healthcare. The right to healthcare for the majority is at odds with the right of Wall Street to profit off of healthcare as a commodity. The struggle for healthcare from below focuses on public control of our hospitals and healthcare facilities, public development of medicines and treatments, and the overall decommodification of the healthcare system. In other words, the abolition of a healthcare as a Wall Street industry and market commodity. Part of the reason why our theory of change calls for a movement from below is because we know that this is the only way to truly and fundamentally change the system that we have. We study our healthcare system, as we've done so far in prior Saturday schools and in our seasonal studies, and we've come to understand more clearly the current structure of our healthcare system. We're clear that it is not a system that can be dismantled by a single piece of legislation or a change in who is paying for what. The Nonviolent Medicaid Army's demand for Medicaid for all is distinct in a number of ways from single payer organizing. Single payer, such as Medicare for all, focuses on public money going to the privatized provision of healthcare, as well as following a reform-centered model of organizing. This next quote is from an article written by some of the early founders of the single-payer movement, and it illustrates this. Single-payer proposals envision payment flowing from a universal, tax-funded insurer like traditional Medicare to independent clinicians, individual hospitals, and other locally controlled nonprofit providers. But insurers are now being joined by a new set of corporate middlemen asserting control over American care. Today, most doctors are employees of large corporations, and most hospitals have become subsidiaries of corporate enterprises encompassing many facilities and firms with tenuous ties to the communities they serve. These sweeping changes require an expansion of the traditional single-payer vision. Reform needs to go beyond changing the way we pay for care. It also needs to change whom we pay for care. Here, even with the original leaders who advocate for Medicare for all, they recognize that it's not enough just to change where the money's coming from. Our healthcare system is increasingly a source of profit for the ruling class and is increasingly being taken over by entities that value their profit over our health. The call for Medicaid for all is based on the fundamental need to decommodify healthcare. Our vision excludes the notion of a universal system that is run by the profiteers. Well, let's look at our country's privatization of healthcare. Privatization is actually taking place in all capitalist countries, even those with universal coverage. But in the US, privatization takes specific forms, and now it dominates the government-funded healthcare programs. We also have private equity takeovers, not-for-profits making billions, and insurance carriers consolidating services and providers, becoming both the payer and the doctor. In this next slide, we see that now 73% of all Medicaid beneficiaries are managed through private managed care organizations. 53% of all Medicare beneficiaries are covered by privately run Medicare Advantage insurers. Yet when we look back in 1983, only 3% of Medicaid beneficiaries were managed privately. When we call for Medicaid for all, we determine our healthcare needs, not Wall Street. In this slide, we have KKR and Blackstone, who are private equities, got together to recently acquire control of 40,000 medical providers, 1/3 of all emergency room services, and 10% of all dermatology services, worth $750 billion. While the costs and profits of U.S. healthcare continue to grow exponentially. So in the U.S., spending for healthcare in 1970 was $14.1 billion. Now in 2024, 5.3 trillion with a T. Looking at this next slide, at the cost of commodification of healthcare to people. The total number of people under 64 years old without health coverage has increased by more than 1.3 million to over 25 million in 2024. 48% of underinsured people pay over about $2,000 in medical debt. Remember, these people have insurance. Consolidation of all services is a primary cause of the rising cost of care, while we see declining access to services like specialists, dental care, and behavioral therapies. In terms of personal accounts of the effects of commodification of healthcare, in my own personal experience as a medical provider, I was valued by my boss, a physician in administration, first and foremost by the number of visits I was able to generate in a day, while I was valued by my patients by the time, effort, and communication I made to work through their challenges with them and their support system, an effort that takes time. Though my efforts reduced rehospitalization and enhanced patient satisfaction, I was deemed unproductive and less valued by the department head. I was passed up for a position I really wanted. Here's another story on this slide from a recent Medicaid Monday. I'll read their story as soon as I bring it up. Here we go. It's from Michelle and her husband in Southeast Pennsylvania. My husband has high cholesterol. He was managing it with medication, diet, and exercise when his triglycerides sent him into acute pancreatitis. He spent 7 days in the hospital, half of that in the intensive care unit. We have good private insurance, but we struggled with the thousands of dollars in hospital costs that our good insurance didn't seem to cover. From the moment we left the hospital, we were bombarded by calls and letters demanding that we pay all of what we owed right away. After a lot of panic and a little research, we learned that the hospital had to accept whatever we could pay, as long as we paid regularly. We settled on a payment, but we still got calls encouraging us to use credit to pay it off sooner. Some months, we'd get 2 bills, and my husband would call and argue that we already paid that month. After that, he'd go to the hospital billing office every month, drop off a check, and get a printed receipt. The whole experience felt like harassment, and we were nothing more than a dollar amount to them. This is why I'm committed to fighting for a healthcare system that puts people over profits. Please, if you would, put in the chat a personal healthcare story where you felt more like a number on a financial spreadsheet than a person. We know that a system like this won't be dismantled by a single piece of legislation. We've seen that from experience within our own network, such as with the fight for single-payer health care in Vermont in 2011. After a monumental organizing effort, Green Mountain Care was signed into law, but its implementation was abruptly halted following a massive counterattack by Wall Street and their political hacks from both parties, as well as by the diluting effects of foundation grant money. In this slide, we see Sarah Weintraub writing in this campaign. She was one of the original leaders of this effort that started in 2008. After deep reflection following their defeat, they came to more clearly understand the system they were up against and the most effective strategy to change it, making a win from a loss. Sarah quoted, "Anything we win can be taken away at any time until we have actually won power over the wealth and resources of the world and reshaped how they are organized and distributed. Winning something at this point, even something that feels as huge as universal health care, only matters as much as we can use that victory to build leaders and the kind of organization that can someday allow us to force, as Reverend Dr. Martin Luther King Jr. put it, a fundamental redistribution of political and economic power in this country." We are demanding a different vision of healthcare, one that prioritizes our health rather than profiteers' right to profit. For that vision, a vision of healthcare from below, again, we need a movement from below that can create that fundamental change. We have shining examples in history that give us hope and direction. From the building of hospitals and Reconstruction following the abolition of slavery, to the revolutionary Cuba, the civil rights movement, and to the Young Lords and the Black Panther Party. Medicaid is a way for us to frame that vision, not just because it connects to the experience of the poor and dispossessed in the most concrete way, but also because it's the closest thing we've had to actual universal coverage. During the peak of the COVID pandemic, when we were able to have our Medicaid automatically renewed, over 90 million people had access to care. This is the closest thing we've ever had to actual universal coverage. Demanding Medicaid for all is a way for us to demand a vision for fundamental change in healthcare beyond just who is paying. We're demanding a revolutionary change in the values of our healthcare system and the abolition of healthcare for profit. Medicaid for all can only happen once healthcare is no longer a commodity, but a right. This will only happen when we have public control over the decision-making and allocation of needed resources. The struggle for Medicaid for all will connect us with the leading force in society that must be organized to lead us to that outcome.
Big appreciation to Bruce for sharing that content with us. Show some love for Bruce. We'll make sure to pass it on for that deep dive. And yeah, as he outlined for us there, right, the way our healthcare system looks now, the structure of our system as it is increasingly privatized, increasingly at the whim of companies, insurance companies, private equity companies, forces that are prioritizing their own profit over our health. And I'm seeing some stories of people experiencing that in the chat. So feel free to keep sharing your stories there. And so what we are demanding, as Bruce said, when we say Medicaid for all, doesn't necessarily just mean that we want Medicaid as it looks right now, which is highly privatized in a lot of different ways, but it is a way for us to build a movement that actually changes the way that we think about healthcare and how healthcare is organized in this country. It is about, as I think was said, as Benny said in the chat, it's more than universal health coverage. It's taking control of the system, lest it all get clawed back, right? So taking back control of the system, decommodifying healthcare, turning it away from something that is a commodity, something to be bought and sold in a marketplace, into something that we actually all have the right to have as a function of being someone who is alive and living here. And so that change, that fundamental change from the system we have now, is to what we are fighting for when we are talking about Medicaid for all. And again, feel free to keep sharing stories in the chat. I think a lot of us have felt that way that our health is deprioritized in favor of the profit of these companies. And uplifting those stories is a way that we can continue to fight against the system that we have and meet and organize new leaders. And I'll pass it to Susan actually to take us deeper into that.
Thank you. Thank you so much, Mark and Bruce, for that very clear presentation. We need that more fundamental change from below, a change that allows us to take control of our own healthcare system and make it a system of taking care of the people's health, not making profit. And we believe that Medicaid can be that system for all the reasons that have been talked about. It is a system that is serving our people. It is a system that people overwhelmingly like and think it is important in our communities. But in order to make Medicaid for all a reality, we have to deal with some mental fortresses that are standing in the way. Mental fortresses are fixed ideas, assumptions, or beliefs that we have that are not true, but that we act from because we've been led to believe them, often by the ruling class, as a way to disorganize and divide us. So the first mental fortress that I'll mention is the belief that Medicaid is bad, that people don't want to be on it, the belief that Medicaid is a last resort healthcare you turn to because you don't have anything else. And we are taught to feel a sense of shame and a sense of failure around being on Medicaid, much as we are taught to feel a sense of shame and failure around being poor. And it is only a mental fortress. It is not a reality. But the experience of people receiving care through Medicaid can often be different. Some people have shared that Medicaid was the best health care they had. That when they earned more money, so they no longer qualified for Medicaid and were on insurance through their work, the coverage was not as good. And I would like to ask Robin Stevens in Pennsylvania, who's on the call today, to come off mute and tell her experience with health care through a free clinic and Medicaid. So go ahead, Robin.
Good afternoon, family. I'm Robin. I use she, her pronouns, and I'm part of SEPA in Southeast Pennsylvania, and I'm glad to be here. Thank you, Susan. And so I've had experience with Medicare, private insurance, no insurance, and now that I'm retired, I'm back on Medicaid. And I love Medicaid. It's the best insurance I've ever had. Yesterday, I had an EKG. I can only imagine what that would have cost. And I'm old. I probably need it. I've never had an EKG. I picked up a prescription. I paid $12.50. When I looked at the cost, it was $2,600 for 90 days. Like, it really helps me to stay healthy, and it's not gouging me. Like, it's the best insurance I've ever had. I had it when I was young, and I had two small children. And then when Clinton came with all the changes to the welfare system, and you can only be on for 3 years, and I had to go to work, then of course I made too much money, and I had private insurance, which sucked. It was so expensive, and then the premiums were high, and then to go to the doctor, it cost money. Every little thing I had to pay for. But with Medicaid, I pay for very little. I go to the podiatrist. I've never been to a podiatrist. I pay $10. I mean, it's such a blessing to have this insurance. I feel so much better about the quality of my life because I know if I need a doctor, I can go to one. And I'm not going to have to pay through the nose, or I don't have to worry, well, geez, can I even afford to go? It's just such a blessing. It is. And I believe everybody deserves this kind of insurance and to have this kind of peace of mind. And I'll leave it there.
Thank you so much, Robin. What a powerful testimony, exactly to the point. And in fact, a few statistics for the Kaiser Family Foundation survey last year. More than 2/3 of adults say they, a family member, or a friend are on or have been on Medicaid. That is the majority of us, which is why we see Medicaid as a way for us to connect to the largest portion of our base. And if we can look at the next slide, we can see that more than the public actually holds overwhelmingly favorable view of Medicaid. And we just heard an example of some of the reasons from Robin. So this tracking poll found that more than 8 in 10 adults have a very favorable or somewhat favorable view of the program. And while less than 1 in 5, or 17%, have an unfavorable view. And then on the next slide, we can see that nearly 97% of adults across the political spectrum believe Medicaid is important in their communities. 3/4 of those saying it's very important. That's a lot. This statistic tells us that Medicaid for all is and can be a unifying force in our class. And then in the next slide, we can see that really there aren't many people in any of this is not a Democrat Republican thing. This is a human rights thing. Few people believe that there should be cuts to Medicaid, only 17%. The Medicaid work requirement alone, however, is expected to cut Medicaid nationwide by $326 billion over 10 years, impacting Medicaid recipients, including 1 in 3 children with cancer and 1 in 10 adults with cancer. And many will lose their Medicaid, not because they aren't eligible, but because of the burden of proving they meet the work requirements. This is a crucial time for us to connect with and agitate our base around these cuts and denials. And in the next slide, we know that cuts in Medicaid have a devastating impact on rural hospitals, as these findings from the Chartist Center for Rural Health point out. Here in rural Wisconsin, the Hospital Sisters Health System closed the Sacred Heart Hospital permanently in March of 2024 after serving the Eau Claire community for more than a century. And at the same time closed St. Joseph's Hospital in the nearby Chippewa Falls area. Closings like these cause huge impacts on communities, and I know many people in the call have experienced this in your communities. People have to travel much farther for their health care, and this impact could have serious, if not fatal, consequences. So if we are going to unite our class in a fight for the healthcare system that works for everyone, we have to clear up the mental fortresses that keep us in disorganization and keep us blaming each other, and frankly, sometimes blaming ourselves. And what we need is leaders who have the direct experience of navigating the healthcare system and who can connect their experience to the experience of others and draw the lessons from all of this that we collectively need to fight the commodification of healthcare. And this is where our ongoing Medicaid Mondays campaign comes in, as we saw from the beautiful Mishtika at the beginning that Kelly shared. So in the next slide, one more. In the next slide, we see that Medicaid Monday stories help us identify our leaders. They bring us out of isolation and help us see the patterns and connections, learn the lessons that will help us organize for a healthcare system that actually works for all of us. And going back to our theory of change, the experience of Medicaid, as I think both Mark and Bruce mentioned, though that experience of Medicaid is a way of forging our leaders in a struggle, so that we are able to fight effectively for a system that works. And so on the next slide, it's a beautiful story wall, I think submitted from Yu Ling. When we post, publish, or speak our Medicaid stories, we demonstrate a visible and immediate example of our growing organization. All of those stories, all of those people show all across the country we are getting together, we are connecting, we are sharing our stories. We are a web of strength, the strength that we need to make this transformation that we know that we need. And in the recent national call, we practiced telling our stories in the plight, fight, insight format. We need people to know not only the struggles of our folks have had, but also how it looks when Medicaid is working for them and their families. We need to know what is possible, how it has been life-saving for their families, and why everyone should have access to it. So Medicaid stories are really our living roadmap of what healthcare based on people's rights to healthcare, not profiteers' rights to profit from them, from healthcare, can look like. Stories about long-term care through Medicaid are also important, reminding us that it is Medicaid covers the long-term care that we need beyond skilled nursing following, or the skilled nursing care following hospitalization. After that, what about if we need long-term care? For myself, I have a diagnosis of osteoporosis, and I found it virtually impossible to get private long-term health care insurance that would pay for, a long-term stay in a nursing home or long-term home care. Even the cheapest residential care provided by the local nursing home in my hometown of Monroe, Wisconsin, is over $1,200 a month. And I don't know too many people who have that. It would be impossible for most people to pay that out of pocket. So I would definitely need Medicaid to cover long-term nursing care if that happened. So we have a couple of minutes before the small group breakouts, and we've had some beautiful stories coming through in the chat. And if anyone wants to come off mute and share their own story a little bit, we have a little time for that. Or something that's been resonating for you during this call.
I'll share.
Go ahead.
Yeah, it was, I wrote it in the chat thing. I had some struggles with a dentist. They can't find a dentist, and the insurance says, "Oh, well, these are all the providers." They're not really there. Okay, none of them accept Medicaid anymore, or more new patients. And I had really nice teeth. My parents spent a lot of money on braces, and all the things I've had to wait so long to get stuff done that I'm actually losing my teeth now. They're so bad. They're like a cracked tooth with a cavity, that didn't survive, you know? So when I had an appointment one day and there was 13 minutes late and you canceled me on the spot right there upon arrival. It took me 45 minutes to get there. I had to take a day off of work, get a substitute teacher, and I had a toothache. So it was like, it didn't care at all, and didn't care in the world that this toothache had brought me to urgent care twice because I got sick, it's a toothache. So they really don't treat you very well, treat you horrible. And I know this from experience because at one time I didn't have Medicaid. So I know how I was treated then and now. So it's
Thank you so much, Helen. I really appreciate that. And I think I will pass and thank you everyone for all the wonderful things you put in the chat. I will pass it back to Mark to introduce our breakout session.
Good.
Thanks so much, Susan. I saw Joy and Joe had their hands up as well. Appreciate you being ready to share. And I think we'll still have that chance to share. We'll still have that time to share in our small groups, which we are just getting set up right now. Thank you, Nick, for getting that. Sorry, I just wanted to update these questions. Yeah, thanks, Nick, for dropping that in the chat. Yeah, Joy and Joe, if you want to share your stories and your experiences in the breakout rooms, I think that'll be really awesome. So we're gonna spend the next 20 minutes or so in small group breakouts to go kind of deeper into some of these ideas. I know we shared a lot just now around how we think about Medicaid for all and some of the way that our healthcare system looks right now. and also stories, everyone's own stories engaging with this healthcare system. So we're going to spend some time talking to each other in our small groups, focused on these 3 questions. So number 1, how have you used the struggle for Medicaid to connect to our class in your region or organization? Number 2, how does the slogan Medicaid for All help orient us towards the leading social force, which is the group of people in society that has the most to gain and the least to lose from fundamental change? And how have you used or seen used Medicaid Mondays, shifting the narrative and combating mental fortresses around Medicaid and healthcare, like Susan just talked to us about? We'll put these questions in the chat as well. Thank you, Evan, for doing that. And again, thank you, Evan and Nick, for doing tech for this session today. There's also a document there that Evan put in the chat where folks can take some notes in your discussions. Please take some notes. They're super powerful and helpful to look through after. So like I said, we have about 20 minutes. We'll go until 2:20 for this. And if groups are ready, we can.
Hi, Joe.
Welcome.
Hello.
Welcome back, y'all. We've reconvened. Everyone's back in the same place. I know it's never long enough time to have some of these discussions, really kind of meaty discussions. We have a few minutes now. If anyone wants to share any thoughts that came out of their small group, feel free to drop some things in the chat, and maybe we can also take 1 or 2 comments in the main room. Yeah, go ahead, Joe.
Yeah, hey, I just wanted to say that, I was listening to as the one fellow was speaking. I can't remember his name, but it dawned on me what he was saying, and I work really hard, and it seems like the more I work, the poorer I get. Well, I don't understand how this happens, but when it comes to the Medicaid Mondays, I actually use my story to help me connect with other people. And then I try to get them connected to other people and put people first so that,
That's right.
for the support so that we can come together. And like my really good friends are like family to me. I connected them. And, now it looks like they're going to be growing with us maybe a little bit, which is awesome. So I like to think of myself as a spider spinning a web of connection. I just see connection. The web connects from limb to limb or from area to area, and it stabilizes itself. And that's what we do when we connect.
I love that. I really love that, Joe, as an analogy. We are building this web of connection across each other. Yeah, that's awesome. Joy, go ahead. You're on mute. Yeah.
Okay, we good now?
Yep.
I also want to go on Joe's thing because he hooked me up with 2 of his friends, Katie and Nate. And I just want to say it's wonderful how they want to get back into put people first from when I was talking to her. So that's a big accomplish too, because Joe and I have a one-on-one here later on. But when he got me connected to them and she started talking to me, it's like really great how they want to get back in it.
That's really awesome, Joy. Yeah, so we can build those connections and we strengthen those connections with one-on-ones and conversations and bringing people back in and closer together. Awesome. Thanks, y'all. Feel free to keep throwing in some appreciations and comments in the chat. Really loving the chat conversation going as well. We can bring up that very last slide, and I'm going to pass it back to Rika to close us out.
I'm just waiting for the slide to pop.
Yeah, no worries, Rika. Just
Next steps in closing. June Nonviolent Medicaid Army National Call earned media. June 25th, 7 p.m. Eastern, 6 p.m. Central, 5 p.m. Mountain, 4 p.m. And that is the link to register. Next Saturday, School of a Struggle. You can't think your way out of poverty, but what can you do? That will be on Saturday, July the 11th, because 4th of July, we will not be having Saturday school. So that's the link to register. And again, the time, 1 p.m. Eastern, 12 p.m. Central, and 11 a.m. Mountain Central Time. Share your stories with Medicaid Mondays, Medicaid Monday forum. Spread the word on social media. Join the Nonviolent Medicaid Army in your state and organize. And those are our next steps. And now, who are we?
The
The
Medicaid
Medicaid Army.